bring your elbows closer together. Wow. Scale from 0 to 10, 10 being the worst. What would you rate your pain right now?
I would say it about 8, 9.
Gosh. So you trust your wife?
She is 100%.
Yeah. She surprised you. Is this
She surprised me.
This is your Valentine's Day
Exactly.
present?
I would say so. I feel like I'm
Delicious.
in a dream tonight. The tension going away. What a relief, man. Oh, long time ago.
Almost 10 years ago.
Yeah.
Tell me what's bothering you. I can see it.
It's the neck.
Okay.
I cannot sleep. I've been, using different pillows and so many medicine, so many, different pillows, and it's been a long time.
Wow.
Yeah, since I believe 2013, 14. It's been a
Almost
while.
10 years?
Yeah, about so.
Scale from 0 to 10, 10 being the worst. What would you rate your pain right now?
I would say it about 8, 9.
Gosh.
Yeah.
Can you describe the pain for me?
Well, it's kind of stabbing, and it comes and sometimes goes away. But I've been taking the ibuprofen, but it's not what I want to be doing.
No,
It's
absolutely not.
Yeah.
Man, that sucks. I feel
Really
bad
bad,
for you.
really bad.
So, do you have headaches, migraines, stuff like that?
No headaches.
So just neck pain.
Just
Can
the
you
neck
point to where it hurts?
From here, all the way here, and it comes here.
Got it. So here, and then here
Yes.
as well. Okay, look straight. Anything in here, the mid back?
Not much.
Okay, anything in this lower back?
No.
So just here, and then here.
Yes, and the shoulders sometimes.
What have you done to try and fix this?
I will say that about probably 20 days ago, I tried the epidural.
Okay, how did that feel?
The next day, I felt the same.
Hmm.
Yeah. According to the doctor, it was gonna be quick fixing, but no.
No. So it's something that's really structurally bad
Yeah.
in there. What else have you done?
Massages, but it feels good in a moment, but after 5 minutes, feel the same.
Okay. Have you seen any chiropractors or anything?
I did in the past.
And?
I will say maybe in the year 14, but didn't fix anything. It was just just little cracks, and that was it.
So nothing really did.
Nothing helped.
Did you try like an extended plan or anything like that? Or
No.
just once?
No.
Because it just didn't help you at all?
Right.
Okay. Honestly, man, I'm going to be very frank with you. The fact that you've been dealing with this for 10 years now, and it's an 8, 9 out of 10,
Right.
this can't be like a one-time thing.
Workforce.
It can't be, because your body, and I'm going to give you reasons why. The way that your body is right now, it's been like, and we haven't gotten to the x-rays yet, but it's been like this for the past 10 years. When your
Right.
body is like this for the past 10 years, it accumulates different inflammation, different tension, scar tissue, shortening of muscles and ligaments, and just the unhydration of your spine as well too. And when that happens, it just really, really, really makes it tough.
Right.
In the past, have you gotten through any car accidents, trauma, slips, falls?
Car accident, yes, probably about 2-3 months ago.
2-3
But it
months
wasn't. Yeah, I knew the car was coming,
Yeah.
but I hold myself on the steering wheel, and it wasn't pretty bad.
Based on the x-rays, what I see here, I think it is possible for us to help you. The thing is, I don't know how much we can help you altogether at first.
Right.
Because I need to see what your body feels, how you respond. And what I mean by that is, like, I don't know if I'm going to need to see you once a month, twice a month, 4 times a month. Like, we don't know
Right,
this yet.
right.
What I do know is that it will take some time just because of the state that you're in. But I am really hoping that today we take a significant step forward. And that's what really I'm hoping. And I believe that for anybody that comes in here.
Right.
And we pray for everybody that comes in here. Let me ask you, obviously you're in pain, but why us? Why did you decide to come see us?
My wife found you on the internet. Yeah.
So you trust your wife?
She is 100%.
Yeah.
She's
good.
a teacher.
That's the right answer.
She's a teacher, and
Okay.
and she goes online a lot because of the kids, the students, and she found about you, and then she said, you know what, you already you have an appointment.
Oh,
so
wow.
I'm gonna go see him.
She surprised you. This
She surprised me.
is your Valentine's Day
Exactly.
present?
I would say so. Yeah.
All right. Well, let's make her happy. Happy wife, happy life, and I don't want her to
Excellent.
come kill me or
Yeah.
anything like that. So when we look at a neck, we are always looking for this curve that's in your neck. Now this is a normal, this is yours. So we want it to look like this. Now for the most part, yours does look like this, but you have basically too much. And when you have too much, it's almost like you're doing this all the time. And
Exactly.
It's is that how you feel?
Yes,
Yes.
that's how I feel.
So when I'm measuring this, when I measure this normal one here, it's 43 degrees. So I'm gonna measure yours here just like this. And so when we measure it, instead of it being at 43, you are at 50. So you have, or 51, you have way too much curve in that spine. So you're using that neck thing, and normally, with most people, it should feel good, but you actually need less of it.
Right.
So you need something that's a little bit flatter, which I can't tell you the last time I told somebody.
Right.
Most people have a lack of curvature in there. But I think another part of you being like this is also because this middle part is probably moving a little bit too far forward. So we're not just going to attack here. We need to attack here and the rest of that spine as well too. Now, the other thing is that when you look upwards, what we start to see is something not good, because everything starts to get really crunched, especially in this lower part here. See how there's a space in here?
I see it.
Do you see a space there?
No.
No. Space there, yes. Any space here?
No.
Any space here?
No.
And there's a space here.
Yeah.
So you need those spaces. The reason why you need those spaces is because there's a nerve that exits. So this is that space. There's a nerve that exits out of that space that allows your body to say, I can be okay. But if it goes like this, what happens to the nerve?
Pain.
It pinches, right? Pain. That's exactly what happens. So when we're looking at this, you can see that it's all the way out.
Right.
And that's going to cause you some more pain. And even when you're looking straight, that's starting to happen here too. And I think honestly, that's probably why you're in so much pain, is because you have too much, and you can see this there, this is okay. Oh no, it's pinching here, and then this becomes okay again. So it's always like that. So I need to uncompress you and allow this to become straighter so that your neck can start to feel a little bit better. The one thing I always like to ask is, how do you feel like it's been impacting you in your daily life?
Not pleasant.
No.
No.
What do you
Very
feel?
uncomfortable.
You feel like you're cranky?
Yeah, well, I try to manage, but it's not easy.
That's really
because the pain is always, the pinch is always there. Yeah. I wake up in the morning really bad. So I have a roll, small this size, and I roll myself.
Does it feel better?
It feels better.
Okay.
But for, I would say, maybe 2 minutes, 3 minutes.
Okay.
Feels good. But during the day, it starts, coming in again.
What do you do for work?
I am a salesperson of electrical work. Yeah, electrical material.
Do you feel like it affects your sales?
Not really.
Okay.
Not really.
Good.
It does.
Well, we don't want to. We
Yeah,
don't
of
want it
course.
to, because at some point it's going to.
Right.
I know, like, if I come in and I'm tired and I'm just like, and I'm hurting for some reason.
Right.
I just don't even want to be here. And I'm like,
Exactly.
So you don't want to do that.
Right. Yeah.
So in reality, it's affecting your mood.
It is, yeah.
That's why your wife really brought you in here.
Right, exactly. Yeah.
I need you to be nice
Go
with me
again.
today. Slowly turn your head to the right. Yeah, that's not good. So nose is about like 40? Yeah, 40. Going that way. It's not ideally, you want to be closer to 90.
Right.
This way. Look to the left. It's a little bit better. So it's like 50, 60-ish here. Nose is like that. Let's have you look straight. Painful when you look to both sides?
Yes.
Can you point to where that pain is? Look to the... So when you look to the right, when you look to the right, where do you feel the pain? Point to it.
Here.
Right there?
The muscles.
Okay. And then when you look to
It goes down here.
Okay. Let me do something. I'm going to have you look straight.
Yeah.
And then turn your head down a little bit. Now turn to the right. You still feel that tension here?
A little less.
A little less. Okay. So that tells us that when you have a little bit less of that curve, you're easier. So if you're... Basically what's happening is basically if you have facets that are like this, okay? That's kind of how it is in the neck. If you jam it more, it's harder to turn.
Right.
But if you open it up a little bit, then it's easier to turn and move around that area. So you're just too jammed. When you look to the left, where do you feel the pain?
Same place.
Same place?
Here.
Okay.
Yeah.
So just opposite sides, right?
Right.
Let's have you look all the way up to the ceiling. Is there any pain when you do that?
Yes.
Yeah, you ain't going up either. Let's have you look down to the floor. Any pain when you do that?
Yes.
Okay.
Right here.
Oh, there. Stand up for me. I want you to walk. Walk towards me this way. and then go back down that way. Okay, and then come back down towards me again. So one thing I'm noticing, right side, right shoulder is higher. This part is just moving so far off. So your head is so translated to this left side when you walk. And you're putting a lot of pressure in this area. So we need to loosen this up so it doesn't continue to shift your head over that way. Okay. Keep that left leg straight and lift it up as high as you can go. Does that hurt at all when you do that?
Yes.
Where do you feel the pain at?
In the middle of the back of the knee.
In the back of the knee?
Yeah.
Okay. Do the right side now too. Does that hurt?
Here.
In the back?
A little here.
Okay. So we're seeing a few things. It's not even just the neck. We see some restriction. So it feels weird, but the way that your spine is settled, it's also going to affect how your neck is as well too. All right. So I'm feeling a lot of pressure into this area here. And then right in through here, you can feel this when I press here. Doesn't feel that nice. This is okay. Then this gets kind of stiff and tight right there. So I want you to loosen this leg here, okay? I'm going to pull a little bit because we need to just open here, nice and quick. Yeah? That hurt?
No.
Okay. That was a lot. Let's go here now too. Not so bad on this one. Yeah, left side for sure. Good. And left leg up one more time. Heck yeah, right side. Whew, good.
Better.
Much better, right?
Way better.
How old are you?
I'm 55 now.
55. You look
Yeah.
great for 55. You don't look
Thank
a day
you.
older 54. I'm just kidding. I'm just kidding. No, you look great for your age, honestly.
Right.
We just want you to match. We want your body to match.
Right.
We don't want you to feel like an 80-year-old and be 55. And relax your shoulders for me. Just be as relaxed as you can. Okay, you're gonna keep your head down. We're gonna go back just like that. Good. Relax your shoulders for me. There. Oh, I'm gonna let you go
wow.
now. Whoa.
Wow.
Yeah?
I can feel losing the tension.
Mm-hmm.
Wow.
That thing was super stuck and tight. Let me take this hand here. You're gonna go, hold on, right there. Let me take this other one right here underneath. Good. Relax this hand a little bit. There you go. Relax your shoulders. Better. Head down. Head down. There you go. Remember I said I didn't like this area here? We're gonna roll all the way back. Yeah. Shoulders first, relax. Shoulders down, now the head. Ooh. I'll take this.
Wow.
That was gorgeous.
I feel like I'm
Delicious.
gonna dream tonight. Oh. Feels way better.
You can say it, it's okay, you were right. You were right, wife. What's your wife's name?
Nelly.
Nelly? Say, you were right, Nelly.
Yeah. 100%.
Good. And relax your shoulders there for me. I'm gonna go right here. So what I'm trying to do here is open this upper part, just like this. We're gonna try this way first. Bring your arms closer together. That's better. And then I'm gonna roll you back, all right?
Okay.
And then go all the way back. Good. Relax your shoulders now for me. Good. Deep breath in, out. Bring your elbows closer together. Ooh, wow.
Wow. Oh, wow.
How did that feel?
Oh, wow. Feels really good.
Yeah.
can feel the tension going away. What a relief, man. When that pain in the neck is on, you can feel everything getting tense and all getting tight.
Yeah.
Yeah.
And that was a big spot for you to get this whole thing.
Oh, wow. Better. Way better. Wow. No words.
Yeah.
No words to explain it.
Feels nice though.
Yeah, it feels really nice.
I mean, that's the whole reason why we adjusted it, right? Is to continue to feel good. I think, chiropractic is great. The best part about it is when you continue to keep doing it.
Right.
Not just because like people have this cynical view of like, oh, they just want you to keep coming back. It's like, no. The thing is, if this got you to feel better,
right,
why wouldn't you want to keep doing it? That's what I mean. Like, when's the last time you felt like this?
Oh, long time ago.
Almost 10 years ago.
Yeah.
You know? Yeah. When we look at your x-rays here, so we want to see this. This is your open mouth view. We can see that on the right side, that atlas is shifted about 32 millimeters. On the left side, about 29 is what we're measuring at. And so what we're trying to do is take that and even yourself back out, which also makes sense because you just have that weird sensation there. So we're going to adjust up here, okay?
Okay.
You ready?
Ready.
Right. So I want you to let your neck just relax as much as possible. Keep breathing. Good. Loosen. Good. Chin up a little bit. Oh!
Oh, wow.
Yeah. Take your time. That was a lot.
When I can feel the tension, it's really hard, to get my head on the pillow every night. That spot right there, I feel.
That's the spot.
Yeah. Only with a roller, I can kind of get to it, but I know that the position to crack myself is, I wish I could do it, but I can't. Oh, wow.
How did that feel?
Way better.
All lower. Yeah.
Oh, wow. Oh. Oh, wow. Definitely got to come more often.
Yeah. I think you need to.
Oh.
For sure.
Yeah, I have to.
How are you feeling?
That side right there feels good. I can feel this muscle here getting free from, all tension.
Yeah. It's kind of crazy, right?
It is, yeah. I mean, how much did this get so tight up?
It's just daily life. It's so hard to always know. You look like you're liking it a little bit. It's great.
Believe me, it's so good. Wow. When I'm sleeping, I'm trying to, try to sleep. It's hard because it's like, when dog goes round and round and round and doesn't relax. You know how the dogs go so many rounds, and I can feel the tension is gone.
That's awesome.
Yeah,
it's really good.
It's really good.
I'm gonna do a couple of things. I just want to see something here. Just want to see if there's motion. Oh, that feels actually really good. Yeah, it has a little bit there. Good. Roll this way and that way. Yeah, good.
Oh.
Good.
Oh.
Take a deep breath in through your nose and let it all the way out. There it is. Deep breath in through your nose. Let all the air out.
Oh, wow. I could feel it at the end of the vertebra.
Yeah.
Yeah. Oh,
Give you a minute.
wow.
It looked like it felt pretty good.
Feels really good. Oh. No need for ibuprofen anymore.
Mm-mm. This will be a better ibuprofen for you. We don't want that anymore. How are you doing?
Completely.
Yeah?
Way different. Feel new, man. Wow.
10 years. It's a long time.
Wow.
It's a very, very long time to live in pain,
Oh.
to live this way. And it's the first time you ever went to a chiropractor, huh?
Wow. First time.
First time. And let's have you look all the way to the right. 100%.
Yeah.
You were like 40 degrees over there before.
Oh, he can see it now. Yeah, wow.
Any pain when you do this side?
No.
Good. Look to the left. Heck yeah.
Yeah. Completely new.
Completely new. Let's have you look all the way up to the ceiling. All the way up. Keep going. You got it. That's where we're supposed to be. You are like
Wow.
nothing.
Wow.
And then let's have you go down. Look to your feet. Yes. All right. Now turn your face towards me. Let's have you walk down again.
Oh, wow.
One thing we're noticing is that your shoulders are moving again.
Yeah.
And you got to smile. Go all the way back down. And let's keep doing that again. I want you to use your shoulders a little bit more. I want you to relearn how to walk, basically.
Yeah.
Because your shoulders have been so tight, you just don't know how to use them.
Way better.
Yeah.
Way better, yeah.
Good.
I'm dizzy now. Because, so much flexibility now.
Mm-hmm.
Yeah. I can feel
good.
it. Before I was having so like ropes,
Mm-hmm.
I felt inside
Yeah.
like ropes. Better.
Good.
Better.
I think you owe your wife a
Way
lot
better. Wow.
Man, I'm glad that you came, and I'm glad that you're here. I'm glad you're part of the family
Yeah.
now.
Thank
Let's
you
just
very
keep this
much.
up. Yeah, we want you
Thank
to
you
keep this
very
up. We
much.
want you to lay on those blocks.
Perfect.
And you're going to be good.
Super.
Okay?
Super.
Awesome.
Thanks a lot.
Yeah.
Thank you
Good
very
seeing
much.
you, man.